welcome to our healthcare forum. It's nice to have everybody here this evening. My name is Bea Gorman and I'm with Tahoe Chamber, and I want to welcome you this evening on behalf of our partner, Barton Hospital, who we're sponsoring this event with. I want to really acknowledge all of you. This is not the most fun topic to take an evening out of your life to come and listen to. So I hope that you will find it super informational and that you'll get some of your questions answered and find the resources to get other questions answered if you don't get them answered tonight.
We're not here to give any opinions on healthcare reform. What we're here to do is to inform you with facts and really let you know what is going to happen with healthcare reform, how it's going to affect you as individuals in this community, so that you can make the best decision you can for you and your family. That is our goal tonight. Wanted to let you know a little bit about what Barton Health has been doing. The Healthcare Reform Act was put into place in 2010, and there have been a lot of changes that have already been happening with healthcare reform. So it's one of Barton Health's major initiatives is to address healthcare reform and make sure that we're doing everything we can to continue to have that high-level healthcare available and accessible to people in the community here. So we have been doing that. One big piece of good news that has happened out of this is the community clinic, which is a clinic that we offer for non-insured, underinsured, and Medi-Cal patients has been expanded, and we just opened it back up on Monday with the expanded facility, completely remodeled. Very excited to have that for our community because we know that there are going to be more people who are going to need that service, and we want to make sure that access is just as available as it was before, with more insured people coming into the mix, as you will hear. The other thing is that we did a community health needs assessment back in 2012, and we identified health gaps in our community. Some of you may have received phone calls at home where we asked you questions about your family's health and your own health. And what we did was we found out that there were top 3 priorities that this community wanted as far as health care, and that was to address mental health issues. You've probably been reading about that a lot, substance abuse, and then access to health care. So all 3 of those things, we've been leading the charge with our community partners here in town and other nonprofit organizations to move the needle on those 3 issues. And I wanted to also let you know that we have been putting together a website with information for you. So you're going to hear a lot tonight, but there's going to be things that are going to change over time. And it's really hard to sift through all the information that's out there online. So what we're trying to do is put it all in one place for our South Shore community. So if you go to bartonhealth.org/reform, we've put out some great resources there for you. There's a nice 10-minute video that you can show your friends and family on healthcare reform. It's put up by the Kaiser Foundation put it together. We also have information on the California and the Nevada exchanges, and then some timelines and other things. So really a great resource if you don't want to go through and read the entire act. And so what I'd like to do right now is we have a slew of experts here that are going to speak to you about health care reform. And the first speaker, we're just really lucky to have her. It's Carmela Gutierrez, and I'm probably butchering her name. She's president of Californians for Patient Care, a nonprofit organization dedicated to protecting the interests of patients and ensuring all Californians have fair and equitable access to high-quality health care. She brings a lot of experience to healthcare public affairs, policy, communications experience in the industry. And she's going to spend some time tonight to talk to you about the major changes that are happening in 2014. Some of you have heard October 1st as the date that is coming up. That's when you'll be able to enroll for the healthcare exchange. And some of the big changes for consumers and the expanded healthcare insurance will happen January 1st. So Carmela is here to give us a lot more detail about that, and I'd like to welcome her up right now if we could give her a round of applause.
Okay, so the new healthcare law on you, we are going to talk about later on as we get through this, the 5 key components that are really essential to know in California. But first, a little bit about Californians for Patient Care. We are a nonprofit, and we're based in Sacramento, and our mission is really to increase access for those who don't have it. The new health law, we're going to go into this in a little bit more about the background. We're going to expand on what Monica was talking about earlier, the timeline, the key components, the requirements for people, a couple of the requirements for employers, and really how some of these new requirements that the law has for insurance companies really benefit you. And then we're going to go into the core five essential elements. As I said, Californians for Patient Care is a nonprofit. We're based in Sacramento, but we help people throughout the state. We have 3 main areas of focus: advocacy, education, and connection. Advocacy, we're the people at the state capitol who advocate for state health policies that are in the best interest of you and the rest of the patients throughout the state collectively. What we do is we support policies that improve access, improve quality of care, and patient safety. On the education front, very similar to what we're doing tonight, we help people understand what the heck this thing is called the healthcare system and this new health law, and where you are in the system, whether you have insurance, whether you have Medicare, whether you have Medi-Cal, whether you're privately insured, we can help you. We can also help people understand that they actually have patient rights and how to work with those patient rights with whatever healthcare provider you're at. How many of you realize that you do have patient rights? Okay. We have a lot more education to do that. You have a right to an interpreter. You have a right to your medical record. You have a right to a second opinion, and a lot more. So we have a lot of resources on our website that can go over those patient rights and more. And if you have an issue with your health plan, do you know where to go to file a complaint? We can help you with that. The other thing that we do is that for those people who do not have insurance or who have a little bit of resources, we connect them to 5,200 safety net resources throughout the state. We have the most robust database that is free for anyone to use in the state, totally searchable by zip code or by address, where you can find out what's nearest to you. It's very surprising and illuminating to most people when they click on, put in their zip code or their home address, and realize that they have clinics and programs available next to them should they lose their job or should they end up in dire straits. So those are the 3 main areas of focus for Californians for Patient Care. The new health law and the timeline. Earlier, Monica mentioned that the health law has some key timelines coming up that are deadlines that are going to be very impactful to people in the room, especially from a knowledge perspective. However, I want to let people know, remind people that this law was passed 3.25 years ago in March 2010. So it's already been in place for 3 years. However, certain elements are getting implemented over time. And in September of 2010, that was when California, the state legislature, passed a law to implement what is called the Health Care Benefits Exchange, otherwise known as now Covered California. That's the insurance marketplace that we're going to be talking a little bit more about tonight, that has used their state power to leverage the volume of people that they anticipate are going to be purchasing plans to be able to offer health plans at reasonable rates for most people throughout California. Open enrollment begins October 1st. Similar to all of us, what we have to go through when we have our employer-sponsored healthcare coverage, the new law is offering open enrollment beginning October 1. Policies go into effect January 1. What's interesting about this first year, to encourage more people to enroll in the exchange who don't have insurance or who want to shop on the individual market, they are extending open enrollment through March, which is really important when it comes to the tax penalty issue. So what this means is that they're encouraging people to enroll by March 15th. That way there's a 2-week window so all the paperwork and all the systems get together before the penalty will kick in. And then of course insurance is required by all legal residents of California in the new year. Okay, some of the requirements that the new law, so we're going to talk in broad scope here. So the new law says, again, that all legal residents have to have health insurance or else they incur a penalty, and that penalty is paid through your income taxes. So when you file your income tax, and all the systems are going to be kind of doing a cross-check to see if you have health insurance or not, and if you don't, then you get a penalty. They require insurance companies, this is good for all patients, so no longer can insurance companies deny you coverage on the basis of a pre-existing condition. No longer can insurance companies have lifetime limits on your policies, which is very, very good for all of us in the room who have health insurance. A couple of things for employers. So employers who have 50 employers or more, and we're going to get into this in a little bit with the expert here from the benefits. He'll talk a little bit more about employer coverage. So this does apply to small companies that have 50 or more employees will also be scrutinized. They will also be required to offer adequate coverage, or they can get taxed and penalized. And then also, employers, though, however, will receive funds to help fund the employer plans or the health benefit plans for the retiree group, those that are too young to qualify for Medicare, 55 to 64. So one of the key components that the law does is the idea is to get everybody covered. And so they're going at this a few different ways. There's the Medi-Cal expansion. And the state of California, the legislators just Saturday, they approved 2 bills which will expand Medi-Cal throughout the state. What this would mean is that 1.4 million more people would be eligible for Medi-Cal. And the big deal with that is that formerly the current Medi-Cal program excludes individuals who don't have children. So now in 2014 going forward, childless adults, if they are at the income level that they are $15,000 and below, they'll be able to qualify for Medi-Cal. Now the other things which we will go over in a little bit too is that if you can't afford a plan now, the big question, most people don't have health insurance because they can't afford it. So now what? So the law requires everybody to have health insurance, but how do you afford it when it's been out of reach for so many people? Well, now the federal government is kicking in some assistance. So, and we'll go through this in a little bit more detail, but people at certain income ranges will qualify for subsidies to help offset the cost of premiums, and also for subsidies on the back end to offset the cost of co-payments and deductibles. So at the front end, there are going to be tax credits, if you qualify, that will be paid directly to the insurance company. And then on the back end, depending on where you are within the income range, they'll get it's a sliding scale, and they'll get capped at a certain limit for your co-payments that you pay to a doctor when you go to a laboratory visit. And then also if you have a big expense, for the hospital. So there are some limitations to help make this more affordable. And then also, for people in the room today and also Medicare beneficiaries, one of the key components of the law is to extend prevention and wellness benefits to everybody. The idea is to invest in preventive care to help offset the cost for medical and sick care down the road. So you might want to ask your employers, because this applies to some plans. There's some things that were grandfathered in, so I don't want to say this extends to all plans, but check into it. A lot of insurance companies now are required to offer free preventive visits, mammographies, colonoscopies, those types of things. What I'm going to talk about now is all contained in here in the 5 things that Californians need to know. This chart up here goes over the 10 essential benefits that are now included in all the new insurance plans inside the California Exchange. It's a very robust, comprehensive plan that deals with the most things that we need. We need sick care like hospitalization. We need rehabilitative care if we get sick. We need pharmacy. And this also includes mental health and also covers autism for those who have autistic children and autistic needs. On to the chart. So the law is very comprehensive. As Monica said, more than 2,000 pages. The law, it's very complicated. It applies to most people in the room eventually. And I want to reassure you that right now, you should be okay if you have health insurance. Typically what we see with health insurance plans, the trend has been that premiums go up, right? The cost that we pay for our part goes up, and the benefit packages have gone down. This whole law is designed to kind of freeze that a little bit. However, my prognostication is that we won't see that for a little bit. So if you have health insurance right now, you should be okay, but expect changes in it could be in the next few years. And my employer expert will get into this in a bit. If you have Medicare, you've got the gold standard. Don't worry, you're in good shape. Okay, the first thing that you need to know, like we talked about earlier, you may qualify for financial help to offset the cost of insurance if you fall within a certain range. Okay, this is all, the new plans are going to be based on income range primarily. 2.6 million Californians will qualify for some kind of subsidy help, and here in Region 3, there are 19 regions within California. South Lake Tahoe is in Region 3. All of this information that I'm going to talk about is really based on Covered California and the health plans that are available through the exchange. They have a live website now where you can go in and put in your own individual information, your income, the number of people in your household, the age of the primary person, the age of the spouse, etc. And they use that data to calculate an estimation of what a plan would cost based on the silver level. There are going to be 4 levels. Silver is the second from the bottom. And it'll also tell you what kind of subsidies you would be able to qualify for. The other thing it'll be able to tell you when you get to Covered California is what you're eligible for, including Medi-Cal. Okay, so it'll tell you your tax credits and subsidies. Tax credits and subsidies. Again, it's income-based, based on your percentage of income compared to the federal poverty level. What does that mean? None of us talk in federal poverty level percentages, right? How much do you make? I don't say I make XYZ. I say I make XYZ in dollar figures. So what that means is for an individual within the range of, let's start off. If I'm a single person and I make less than about roughly $15,000 a year, that would qualify me for Medi-Cal. From $15,000 a year to about $44,000 per year as a single person, that would qualify me for some kind of tax credits and subsidies. For a family of 4, if I make less than, I think it's $31,000, that family of 4 would qualify for Medi-Cal. If I'm in the range between 31-ish and 92,000, family of 4 would qualify for tax credits and subsidies. Again, the more you make, the lower the federal support will be. The less you make, the more help you will get to offset the cost of insurance. So there are about 126,000 people here within Region 3 who would qualify for some kind of federal support. And then for small businesses right now, there is support right out there for small businesses who offer certain levels of health insurance to their employees right now. So if you're a small business with less than 25 employees, today, if you meet the qualifications, you could get a 35% tax credit to offset the cost of health insurance for your employees. That tax credit will rise to 50% in 2014. So if you're already doing that for your employees, there is an opportunity to get even more tax credits from the federal government. So this is Covered California, and it's covered, COVERDCA.com. This is a great resource right now. It has the basics of what you need to know, and what's really interesting is that it has the cost calculator. There's a calculator on CoveredCalifornia.com where you can do your own basic estimation. So this will give us the estimated, now this is based on the silver plan. So it says that the silver plan for this situation with basic information would run $736 a month. However, the government would kick in $460 a month so that the estimated monthly premium would drop down to $276 per month. When you get there in October, it'll be able to take in information from Region 3 because they're going to calculate geography and all this other information in and get more specific. So it will tell you exactly what you will pay at that time. I can't answer that question at this time. Yes, sir.
Now, would that be, would have to pony up the $736 out of pocket and then get a refund?
Okay, that's a great question. So according to this plan and this calculation, it says for the silver plan under this condition, the example says the monthly premium would be $736. The question is, do I have to pony up that money out of pocket every month? The answer is no. The government portion, the $460 that you see up, I'm sorry, you can't see that very well. $460, the government will pay that directly to your health plan. So you would be responsible for the remaining $276. So I wanted to point this out to you that there's some information up here on Covered California that is live and I think would be very important for you if you have questions about what the potential could be. Again, this is rough estimates. It doesn't have anything related to specific plan information yet. So let's get into a little bit more detail of what specifically this would look like for a 40-year-old in Region 3. So there are 13 plans who decided to offer and participate in Covered California. Most regions throughout the state have 5 plans. South Lake Tahoe, this is Region 3, have these plans offered. We have Anthem, the PPO, Blue Shield PPO, Kaiser Permanente, the HMO of course, Western Health Advantage, the HMO, and Anthem, the HMO. So at the top of the bar, it'll have your percentage based on the federal poverty level. We start from 150% of federal poverty. We have 200%, 250, and 400%. So these are ranging like in $20,000 all the way up to, for a single person, you know, about $20,000 up to $45,000. So somewhere between in that income range. Let's take a look at Anthem. At the low range, the person would have to pay $56 a month out of pocket, and the federal government would kick in the subsidy at $276. So at the very low range, at the 150% poverty level, someone could get a plan with all those 10 essential benefits for $56 a month, all the way up to Anthem for $200 a month. So there will be a variety of ranges of plans available for people to take a look at and see what best meets their needs. Earlier there was a discussion about out-of-pocket costs and deductibles. The second thing, and I think you hit the nail on the head, for most of us who have insurance, we know that we're responsible for a percentage of our costs. That's not going to change with the new Affordable Health Care Act. There will still be co-payments for most of these plans. There will still be deductibles. The difference will be is on what plan you choose, of course, and then also what subsidies or tax credits you qualify for. Those people within those income ranges that we talked about will get their out-of-pocket costs, including deductibles, capped. It'll be capped at a max of 9.5%. They'll range from 2% of their income to 9.5% of their income. So there are some limitations for those out-of-pocket costs, including deductibles. The third thing, which we've already talked about, is where to go to find and buy a new health plan, Covered California. In addition to the online calculator, they're going to have a call center staffed with people that can answer questions in California's 13 most popular languages. And then they're also going to have places, if you have questions, that you can actually go and meet with a live person and get some help. And this is how the laws, I mean, the regulations are being written today, so this thing is changing constantly. So we updated this PowerPoint presentation yesterday, and if you look at the very bottom, we call them navigators and in-person assisters. As of today, I had a meeting with the folks from Covered California, and they're no longer are they calling them navigators and in-person assisters. They're going to be called certified enrollment counselors. So I want to bring that information to you so you know they're going to go through serious, rigorous training and certification to understand eligibility and issues. And I want to also remind you that be careful, because this will open up a lot of opportunity for opportunists who want to say, hey, I can help you enroll, you know, come here for 20 bucks. The idea is you want to look for an actual Covered California certified enrollment counselor if you need help. Covered California will have a list on their website of certified enrollment counselors in Region 3 and throughout the state. We've already touched on this, but the fourth most important thing to know is that you're going to have a variety of plans to choose from. There are going to be 4 levels of plans. They're called the metals. The most expensive plan will be called the Platinum plan, and it offers, though, the most amount of coverage for cost sharing. It'll pick up, and we'll see this in a minute, 90% of the cost, and your portion, if you choose to purchase the Platinum, would be 10% of the out-of-pocket costs. You pay more per month on the onset, the premiums, but you get more coverage of your costs when it actually comes time to getting a service. What we want to emphasize here for those folks who are interested in Covered California and purchasing coverage for the first time is stuff that we already know who have health insurance. You got to budget for it. You have to know what your real monthly expenses are, and then you have to know and anticipate what your health needs are. And that's hard to do for people who've never had health insurance, who don't kind of have a history of this, to be able to predict it. But we encourage people to understand what their medication needs are, what potentially their ongoing health issues are. And this is for all of us who may be shopping for a new plan. Do you have a chronic illness? Are you planning to have children? Do you have children? Is there a specialist that you are particularly interested in, or do you have a doctor that you need to go and you have a relationship who knows your care? Those are going to be important when you're shopping for new health insurance, because you want to make sure that the network contains the hospital that you like to go to, like Barton Community Hospital, and also that has all your favorite or your necessary medical professionals. And that's, again, another point to keep in mind if you're shopping for insurance. We earlier talked about the premiums. So what's different about the Affordable Care Act is that no longer is health status going to be considered. They're going to look at your age, geography, your income, family size, and the type of coverage that you're interested in. Statewide, for the 3 lowest level silver plans on Covered California, the average premium is $321. And that's before any subsidies or tax credits are applied. And we saw earlier in that example that someone here could purchase insurance for $56 a month. Again, the monthly premium is a visual of what we talked about. The Platinum plan, again, these are cost-sharing plans. The Platinum, you get what you pay for. You pay more for your monthly premium, you get more of your expenses covered on the outset. Platinum, Gold, Silver, and Bronze. One of the things that we are all encouraging people to do who say they can only afford a Bronze is to be careful of the risk, because a Bronze plan, while it has lower monthly premiums, if you have a medical service that has a high cost attached to it, you will be on the hook for 40% of that cost. Unless, of course, you fall within the 138% of federal poverty level to 400, where those will get capped. So there are all kinds of nuances here. So I want you to take away from tonight a general understanding that Covered California is a place to go. Things are changing. In 2015, we'll have a better understanding of exactly how many people have decided to buy health insurance, what the true costs of delivering care are. But right now, everybody needs to do their best homework to find out what their needs are for their family so that they can make the best decision for themselves. How many of you have read your benefits policy and really feel good about what's in your health benefits policy today? Okay. There were only 3 or 4 hands raised. That is a really telling moment, because a lot of us who are fortunate enough to get employer-sponsored health care take it for granted that we have it, and we don't really know how to shop for insurance. We don't really know how to scrutinize our own health needs, much less to determine which network we want, which health plan we want, what our needs really are. So for people who've never had health insurance and who have had to rely on episodic care, who get sick and will go to the clinic where they can find low cost or no cost care, who unfortunately have to end up in an emergency room, this is a big deal. It is a huge cultural shift, and it is a huge learning curve. So that's why Covered California will have these in-person helpers called the Certified Enrollment Counselors to be able to help people. So what I encourage you to do, if you are interested in, when it opens up, to compare what you have now is to really take a look at what you have now and compare it to find a comparable plan on the insurance marketplace and see what that would run. Because I think it's in all of our best interest to become a little bit smarter about the current policies that we have. Because sometimes our policies exclude long-term care. We find out the limitations a little too late, and we only find out what our health policies are when we're in a crisis. So let's do a little bit of homework. Alrighty, so let's go back into another example, another chart here. Covered California, let's take a look in Region 3, the difference in the platinum, bronze, silver, and gold levels based on all of these different companies that will be offering health insurance. If we look at a single person, I'm going to choose the Anthem, and I'm going to choose Kaiser Permanente. So the bronze level, this is the one with the lowest monthly premiums, but this is also the one with where you have the higher out-of-pocket costs. Anthem PPO at the bronze will run you $250 a month, all the way up to the platinum for $467. We look at Kaiser Permanente for the bronze, it's $261, all the way up to $458. Again, this is before any subsidies, but I just want to show you the variety of plans and the homework that you're going to have to do to take a look at this if you're interested. 25-year-olds, they're in a very special category. Anyone under the age of 29 who does not have insurance today will have the additional option of purchasing a catastrophic plan. We all know these young 25, 26, 27-year-olds, especially here, who are a little bit of cowboys and cowgirls, the young invincibles who think they're never going to get hurt until they end up in a skiing accident after they run into a tree. And then what do? Then they're stuck with a big bill. So Covered California is offering the younger set an opportunity to purchase catastrophic insurance. There's another caveat. The new law allows people up until the age of 26 to stay on their parents' plan. So if you have kids or you know someone who's 25 or 26 and they have the option of either getting their own catastrophic plan, they also have the option, if they do have this, to stay on their parents' plan. So anyway, this whole thing is just to let you know there are options for the younger set too. Okay, penalties, taxes. This is where the regulations kick in. All of the penalties will be assessed when you file taxes in 2015. So if you don't have insurance, people are going to get assessed the first year. Per person, $95 per year will be assessed when you pay your income taxes if you don't have an insurance policy in 2014. Year 2, that's going to rise up to $695 per person, or 2.5% of your income. And here's the interesting thing too. The law applies to everybody. Newborns all the way up to the elderly. However, the penalty for children that parents will get assessed will be half the rate for adults. And also for businesses who have 50 or more employees, they will also be assessed a penalty too if they don't offer coverage or adequate coverage. There are, of course, exceptions to every rule. People with very low incomes will not have to pay a tax penalty. There will be religious exemptions as well. And of course, people who are undocumented are not required to carry insurance. Native Americans and those who are incarcerated are exempt from this law as well. Medicare. For people who have Medicare beneficiaries, as I mentioned earlier, mainly benefits that the new health law requires, puts in place now. It mainly benefits Medicare beneficiaries. For example, free preventive services, prescription drugs. Already, the donut hole is going to be closing in 2020, and there are now discounts at a certain level that people can receive when they go purchase their prescriptions. Coverage is protected. The Medicare plan is protected. You're still able to choose your own doctor. And the doctors are now getting a little bit more financial support through the Affordable Care Act. Bottom line is, if you're on Medicare, you're okay. Californians for Patient Care, our organization, what we can do to help. For people who don't have insurance or who remain uninsured, we can help them get connected to the variety of safety net resources throughout the state. We have the state's largest database, as I mentioned earlier, of more than 5,200 resources. It's very robust. There are about 50 of them here in El Dorado and Placer counties. We have clinics, places where you can get vision, dental care, mental health, prescription assistance with your medications, seniors and veteran services, and more. And one other thing, if you know somebody who is without insurance now or in the future, who for whatever reason cannot purchase insurance or remain uninsured in 2014, and they choose to go to a clinic, and they want to go to a clinic, a free health center, and the local clinic does not have room for, or is booked for a couple of weeks in advance, they have the opportunity and are free to go travel, if they have transportation, to another health center in another county. So people can get the care if they have the transportation options. I don't want people to think that they're limited to a county for county services if they are not a resident of another county. Resources. There are a lot of resources here for you. We have 2 websites. They're connected, calpatientcare.org. The database has its own address, but you can get through it from our main website, myhealthresource.org. We have a toll-free number if you need help. Covered California. They have 2 websites. The first one, coveredca.com, which we took a look at, is their consumer-facing site, and that's where people are going to be able to enroll and compare and purchase plans. healthexchange.ca.gov is the actual kind of the organization's website. They have webinars on there, they have all the meetings, and if you're interested in ever attending virtually a Covered California meeting, you can do that via the website. They have one coming up on Thursday, and it gets interesting, more and more interesting, each and every meeting as we get closer to October 1. So if you're ever interested and you have the technological abilities through your website, please go ahead and check that out. It's very informative. Healthcare.gov, this is the federal government's website dedicated to the law and how it benefits consumers. You can learn more there. CHCF.org, California Healthcare Foundation, is a great resource. And then also for seniors, for those of you who are seniors, who have parents, or who are concerned about this, we have some other additional resources there. I want to thank you for a great discussion, and I look forward to a healthy and happier 2014.
The next thing is, what do you do with it and where do you go once October 1st comes? And that's where my staff comes in. I have about 80 or 90 eligibility workers here in Tahoe as well as down in Placerville, and they're going to be the ones who are going to help people get enrolled in these programs. Now, as was mentioned, that the eligibility, we mostly, traditionally, we've done Medi-Cal. That's what my staff has done. They've helped people with eligibility Medi-Cal. If you have Medi-Cal now, your Medi-Cal will stay. You're not going to lose that. If you're on Medicare, again, that was the gold package. You've got that. That's not going to change. It's all the people who were denied for Medi-Cal in the past. Those folks are going to now have an opportunity to have health care. And the people who make too much money to be on Medi-Cal will now have subsidized programs. What's going to happen in October is we're going to be opening up. Our doors are already open, but we're opening up to more people to come in, and we're going to help people process, all sorts of people process their applications. So if you want somebody to help you with an application, you can come in and see our staff. Now I will tell you, and this was a scary number when I read it, the state has told me that we're going to have El Dorado County, 8,314 new applicants. I've got 80 people. That was a little frightening. Also, they have a computer system that is going to work for all this, but it's not going to work for us right away. The 2 systems are not going to be integrated, the one my staff knows how to use and the state one. So although we're committed to great customer service, our hands are being a little bit tied. So we're going to help as many and as much as we can. We're staffing up. We're going to do extended hours. We're looking at all sorts of options to make sure that we're there to help folks get the coverage. The pre-application period were for people who need services, we'll find out whether you're going to be Medi-Cal, we'll find out, what you need to do to get into the Covered California programs where there's going to be premium tax credits. And if you get all the documents to us, which we'll ask for, we're going to need proof of certain things such as birth certificates, financial information, so we can make sure that we have the right information. The sooner you get to us that information, we can then have your application all ready to go, and as of January 1st, you would get the proper insurance. The other thing that I want to make sure that you're all aware of is the state has, and Carmela mentioned this, has expanded Medi-Cal. We're going up to 138% of federal poverty level, which means that we're going to have thousands of new people who are now eligible for Medi-Cal. Also, one of the big things is up until now, we've had to get on Medi-Cal, you obviously had low income, but then you had to have children, be pregnant, or disabled. Those other links are not going to be part of a problem to get coverage. If you are perfectly healthy, no children, not quite old enough for any of the other services, then that's great. You are now, we don't have any link to Medi-Cal, you would have access to Medi-Cal, and it's completely dependent on income. That's going to be really big for us because we've felt bad. We've had to turn away people because the rules were such that if you didn't have a child, you're not pregnant or disabled, you didn't get services. From 139 to 400% of federal poverty level, and you could look up federal poverty level. I just did, I know Carmela mentioned some numbers. It was just under $12,000 for an individual, and that's really not much. And so, but we can get Medi-Cal for you. That'll be no share of cost at all. And the other thing is, as soon as this happens in October, there's going to be a no wrong door approach. Covered California's website will be such that you at that point can go in and you can enter your own data. If you've got a computer that works at home, go ahead, and you don't even have to come see us. You just can do it online. There's also going to be an 800 number that you can call, and somebody from Covered California will do a quick screen. They're going to ask you 5 or 6 questions and do a kind of an assessment. Are you probably Medi-Cal, in which case you'll come to the county, or are you premium tax credit eligible, or are you going to be a full pay on your own? Those things will be decided. If it's determined you're going to be served by the county, you'll be sent to the county call center. Now, our county is not going to have a call center ourselves, but we are going to have one that works for us and with us, and they'll take your application information. Our local people will work your cases. But the initial information for applications will go through a call center. We'll get all that data in, or you can do it yourself. If you'd rather have somebody walk you through the application process, you come through our doors. So and we're not going to take questions yet. We don't have information on how robust the application process will be yet. I've heard that at first it started out like 80 pages, and they've whittled it down. I'm down here that it was scary when they first were saying that it was 80 pages, and I'm thinking my staff has to enter it in this system and enter it in that system. We're going to have lines out the door. But they're cleaning it up, and they're still working. Also, there are weekly conference calls and webinars and staff training going on, so that we'll be prepared for whatever comes come October.
I just like to see the raise of hands again. How many people have coverage through their employer currently? That's a pretty good majority of the group. So basically, if you're covered through your employer, bottom line, and your employer continues to offer the plans, there's really no impact of all of this to you in terms of the exchange and having to go out and shop on the exchange for benefits if you don't wish to choose so. So really, that's good news to you. You can keep this very simple. If you're happy with the plan there, and by all means, that's going to be your most affordable access to health care, because chances are your employer is picking up a good majority of that health care cost actually for you as an employee. It's debatable whether, some employers may pay a percentage for dependents. Maybe they pay 50% for dependents. Maybe they don't pay any. For your dependents, however, if you're claiming them under your taxes, you're going to have to consider some option for getting coverage for them. So you will have to be looking at the exchange and other access points for that. So I will say, though, for those people who are getting coverage through their employer, good news is all very complicated information. You don't have to worry about anything. However, if it's unaffordable for you to cover your dependents through your employer, that's when you may want to consider some of these things, or if you're not having coverage at all. The other question, I was handed a list of questions here to answer real briefly. I work 2 part-time jobs, don't get coverage at either. What happens through the exchange? Well, that's a very good question. Short end is if you work 2 part-time jobs, and depending on what your income level is, like was talked about earlier, an incredible overview of some of the subsidies that are going to be available, take a look at that. And that's going to be probably your best access point for affordable coverage. And if your employer is not going to start offering coverage, then that's really your main access too, if you're going to be able to get subsidies through the exchange. There's a difference kind of between, as has been pointed out, between large and small group, over 50 and under 50 employer groups. So over 50, they'll be faced with a penalty for not offering coverage. So that's something that they're considering right now, even going in 2014. And we're meeting with a lot of employers and discussing this. What are they going to be doing going forward? The good news is, I will say, most large employers, from my experience in speaking with them, if they're offering coverage now, they're going to continue to offer coverage. So there really is no immediate impact in that regard. You know, your employers that are offering it now, a good majority of them are talking about continuing to offer it. They don't want to be hit with a penalty. Frankly, they can drop coverage now if they want to, without a penalty. So then theoretically, why would they then drop coverage later, only to incur a penalty? So some things to kind of ease the tension of this. There's a lot of information, a lot of concern on some people's part. They're working for a company, they're getting coverage there, what's going to happen? You know, it's been my experience, of course, it's different from every employer, and I can't speak for every employer, but that's been my experience. Small group, they won't be faced with a penalty, and that's a little different scenario. If they're not offering coverage now, they'll be looking at, you know, maybe getting some pressure from employees, like getting access to better, more affordable coverage, and they're going to be looking at the exchange for that. You're going to be looking at maybe possibly your employer as well to maybe start offering that or not offering that or whatever. Small employers, though, they will not be hit with that penalty. We're spending a lot of time talking about the California exchange. Nevada also has their own exchange, and it operates very similarly. There are slight differences, you know, in terms of offerings and how the rates are structured. That information is going to be available on the Chamber website. The link to the exchange and all that information will be available there. I will just point out, though, that some of the carriers are going to be different. You'll notice, like some of the carriers that were brought up here earlier, they may not be the same. They may be the same under the Nevada exchange. St. Mary's, for instance, is a Nevada-based carrier, health system, and carrier based out of Reno, and same with HHP. You know, they're participating in the exchange. They'll be participating in the Nevada exchange. Of course, they don't offer coverage in California, so they're not present on the California exchange. So a little bit of difference on the two. That information will be available on the Chamber website, and basically, if you live in Nevada, that's where you would be going. So with that, just wanted to talk real briefly. Carmela and Debbie did an amazing job, so it's good having them here, and the Chamber and Barton has done an amazing job putting this together, so a round of applause, I guess, is in order for them. With that, thank you very much.